It was one of the most shocking crimes in Texas history. 20 patients of the Nocona General Hospital murdered in their beds. Young and old, some ill, some almost better, all poisoned. And every death happens while nurse Vicki Jackson is on duty. In 2006, Vicki pleads no contest to charges of murder. She's sentenced to life without parole. But Vicki has always maintained that she didn't do it. And now she wants to tell me who did. Is an innocent woman behind bars for life and a serial killer of 20 people walking free? As I walk into the Crane unit in Gatesville, Texas, I wonder if there's another story behind the woman they call the Angel of Death. I'm Candace DeLong. As an FBI agent, I worked on the front line for the world's most powerful law enforcement agency. I went undercover, I trailed terrorists, and I interviewed notorious killers. It's my job to understand the people who others cannot comprehend.
Vicki. Candace, thanks for sitting down with me today. Vicki, when you were a young girl and you thought about your future, what did you see for yourself? What did you want your life to be?
A wonderful marriage, a house with white picket fence, kids, a good career.
All of that?
Yes, ma'am.
So you put a lot of thought into it. And you started working in the healthcare industry at a very young age.
Yes, ma'am.
When you were a teenager. Why were you drawn to that profession?
Because my little brother had asthma, and he was in and out of the hospital, and I wanted to be able to save people. I wanted to be able to take care of them and make them better.
Vicki's childhood dream of becoming a nurse came naturally to her. Family life took a little more work. By 1999, age 33, she had 2 failed marriages behind her, and the third isn't going well. The couple is always arguing, and her daughter is not happy.
My daughter, she told me, "Mom, you need to leave this marriage. It's not good." And I wasn't gonna let a teenager tell me how to run my life. So she said, "If you don't, I'm gonna go to Dad's." And I'll let her go to her dad's.
After having your children for 12 years, now you kind of suddenly don't. What was that like for you?
It was like an empty space.
Empty. How did you feel? Do you recall what the things you thought, felt?
You know, I wanted my children there, but then I was bullheaded and wasn't gonna allow them to tell me who to stay with and who not, you know, and I've already been divorced twice. I didn't want another failure.
Okay.
So I was trying to make it work.
What did your ex-husband do?
He was a nurse's aide.
He was a nurse's aide at the same place you worked?
Yes, ma'am.
How did that go? You're arguing at home and...
We, towards the end, we took separate cars to work, even though we worked the same shift.
In the middle of this domestic turmoil, Vicki goes to see a therapist.
Were you having mood swings?
I didn't think I was.
What did the psychologist say?
She said that it could be bipolar.
Could be bipolar, which is a mood disorder.
Yes, ma'am.
That's a significant diagnosis. Did you receive treatment? Did you talk about treatment?
No, she wanted me to come back, and I didn't go back.
You didn't go back?
No, ma'am.
Did you completely disagree with that diagnosis? I mean, sometimes diagnoses are not accurate. What did you think?
I didn't think she was right.
nothing. And you didn't see that you were having mood swings.
I just thought that the only reason I was mad is when we would argue. And then I was okay when we weren't arguing.
Did you tell your then husband or your kids?
Yes, ma'am. My daughter asked me, what does bipolar mean?
Mm-hmm. And what did you say?
I looked at her and told her that that means I could kill him and get away with it.
By him, Vicki means her husband.
You're having a hard time telling me that. Tell me why.
Because if I'd have listened to her to begin with, I wouldn't have been there.
Okay. When you said, it means I could kill him and get away with it,
I was mad at him.
did you mean it?
No, but I hated him.
And what did your daughter think of that?
I think it scared her.
At this point in her life, Vicki is in a fragile state. She has a potentially dangerous mental illness that is going untreated. Trouble is brewing. Nurse Vicki Jackson always had a genial air of calm when she walked the halls of Nocona General Hospital. She worked the night shift, and as her family life fell apart, it was the one place where she was happy.
I loved it. I would have rather been at work than any place.
Kind of sounds like it offered you a respite from the troubled waters at home.
That respite will be short-lived. By January 2001, the halls are in an uproar. The hospital is tiny, only 18 beds off one long hallway. Normally, they would lose 5 patients a month, usually the elderly. Then the staff begin to realize the death rate has more than doubled, sometimes 2 in one day.
There came a time that patients were dying at the hospital where you worked. Let's talk about that. What was happening?
There was several patients that were dying more often than not.
What were they dying from?
The doctors would say that they were dying of pneumonia, heart attacks. They were older.
Mm-hmm. Okay. And you were there.
Yes.
In fact, correct me if I'm wrong, you were the first person in the room to find them on some occasions?
On some occasions, yes.
And what would you find?
They weren't breathing.
How many times did you find them?
3 or 4.
3 or 4.
Yes.
Police investigation revealed that you were the only person, the only nurse, only healthcare provider that was on duty when these murders occurred.
Yes, ma'am.
Do you see how that looks bad?
Yes, ma'am.
And you were the only one.
At that time, yes, ma'am.
While many patients are dying while she's on duty, others are having strange near-death experiences where the last nurse they see is Nurse Vicki.
There came a time when a man who was having trouble breathing, when the other nurses asked him what had happened, he said, you gave him an intravenous injection, and then he couldn't breathe. What do you say to that?
No, ma'am. He said it was a blonde nurse.
A blonde nurse.
That messed with my IV.
Were there any other blonde nurses there?
I was the only licensed nurse there that was blonde.
One of the patients was a 14-year-old girl,
Yes, ma'am.
and she was, I believe, in the hospital for an appendectomy.
I think so.
Were you ever in that girl's room?
Yes, ma'am.
The mother started screaming because her daughter was having difficulty breathing. Do you recall that?
Yes, ma'am.
Were you there at the time?
Yes, ma'am.
Okay, what were you doing?
She was in pain, and I was giving her shot for pain.
And how were you administering it? By what method? Intramuscular, intravenous? Inter IV.
Yes, ma'am.
And how soon after you administered that did you hear the mother screaming?
Probably 10 or 15 minutes.
10 or 15 minutes?
Yes, ma'am.
Did she survive?
Yes, ma'am.
For every accusation, Vicki has only a quick yes or no answer for me. But those quick answers make it seem as though she's in control of the situation. And as we will see, that is one of the key factors in this entire case. On February 20th, 2001, nurse Vicki Jackson is fired from Nocona General Hospital, Texas. And a 2-month run of unexplained deaths suddenly stops. Vials of a drug that can halt a patient's breathing are found missing from the hospital. And a syringe containing that drug is discovered in the trash at Vicki's home. 10 of the dead are exhumed, and every one has traces of the drug. They've been murdered. Police have little doubt who is responsible. In July 2002, Vicki Jackson is arrested on 2 charges of capital murder.
Do you recall what you thought?
I thought it was crazy. I thought, you know, it's all going to be answered. Surely they can't really mean this.
But they did.
Yes, they did.
They did. And you told them what? Innocent, guilty,
That I was innocent.
regarding the murders.
That I was innocent.
You were innocent.
On the eve of Vicki's trial, the prosecution has 58 witnesses lined up to testify against her. At the last minute, Vicki decides to plead no contest. Her lawyer said it was important to her that she never admitted guilt and was never convicted by a jury.
If you didn't do it and they couldn't prove it, why not proceed through the trial and be exonerated by a jury?
I didn't know no contest.
Okay. No contest, I'm sure you understand now, essentially
I do.
means I'm not going to argue with you, I'm not going to fight with you, I'm not going to go through with the trial.
I did not at that time.
Okay. Do you see how it looks bad
Yes, ma'am.
that you pled no contest?
Yes, ma'am. I do know.
And what was your sentence?
Life without parole.
Vicki tells me today that she was badly advised about her no contest plea, that she thought it would get her a lighter sentence. But I've read the transcript of Vicki's no contest hearing. It's hard to believe she didn't realize what was going on. And she has some other blame to hand out. She's not only innocent, Vicki knows who the real killer is.
They were my husband's patients.
Your husband's patients? All of them?
All of them.
Vicki's husband from her troubled 3rd marriage worked as a nurse's aide at the same hospital.
At this point, were you consciously thinking, I think my husband did this?
Yes, ma'am.
But you went home with him.
Yes, ma'am.
Weren't you scared?
I was scared.
What kind of things were you thinking? I mean, we're
It's
talking about murder here.
It's kind of hard to believe that someone that you are married to, that you loved at one time, could do this. So I was like, put it in the back of my head, surely I'm not thinking the right way.
And what did you do?
I didn't do anything.
Vicki is desperately clutching for a lifeline here. But her stories of who else might have done these murders sank long ago. The problem with Vicki's theory is that her husband had no access to the drugs used in the murders. He wasn't seen in the rooms of the victims, and unlike Vicki, he wasn't even on duty when all the killings occurred. Police cleared him of any involvement in the crimes. As I sit across from Vicki Jackson, I see a woman who just can't bring herself to face the truth about who she is. A serial killer, one of the most prolific that Texas has ever seen. A killer with no chance of parole or appeal, who is still trying to talk her way out of it.
Police say that you killed those patients because you had a problem with them. They annoyed you, or you had a grudge. What do you say to that?
I think it's bull. None of those patients annoyed me.
So that's not true.
No, ma'am.
We've talked about how this crime occurred, that someone was injecting a very, very potent paralytic drug into patients who then would stop breathing and died. Why do you think someone would do this?
Because they're evil.
Okay, evil has many connotations. What do you think was going on in the mind of whoever was injecting these people and taking their lives from them?
They were cold and callous.
But why would they do it?
I don't know.
Why not kick the dog, or?
I don't know.
You have no idea. As the killer was injecting poison into a helpless hospital patient, what do you think they were feeling?
I don't know what they would be feeling.
Do you think they took pleasure from it?
I would hope not.
In a way, looking at that particular crime, the killer is playing God to inject a needle into an IV line and push down the plunger of the syringe, and it's going to kill the person. That's pretty heady stuff. And they did it over and over and over. It looks like it became a compulsion.
Mm-hmm.
I was amazed that Vicki could walk through the murders like that so calmly. She does not crack. I wondered if today she might get closer to finally confessing her crimes, to lifting the burden off her soul. But I think she still has a way to go.
Did you kill those people, Vicki?
No, ma'am.
Do you know who did?
Not 100%.
Is there anything you would like to say to the families of the victims?
Yes, ma'am.
What would that be?
I didn't do it, but I understand your hatred for me. Because if the police told me that you killed my mom, I would hate you. So I understand perfectly, and I'm sorry for all your pain, but it wasn't me.
If you were released, even let's say when you're 80,
Yes, ma'am.
would society be safe from you?
Yes, ma'am.
And tell me why.
Because I don't want to hurt anybody. I've never hurt anybody.
I've seen a lot of these killer nurse cases. Some like the drama and attention of deaths on the ward.
Good luck, Vicki.
Others think they are being merciful to the aged, but Vicki didn't follow those patterns. So why did she do it? Her family life was out of control, and it appears she had an untreated mental illness. So she vented her anger on the defenseless people that she could control. I can't help thinking that if she had gotten help when she was first diagnosed with bipolar disorder, we would never have met. And 20 residents of Nocona, Texas, may have lived their lives a little longer.